Hey guys, it's Dr. Justin Marchegiani here. Welcome back to Beyond Wellness Radio. Fabulous Friday here down in Austin, Texas. I have a good friend, Russ Teams, Dr. Russ Teams. Actually went to chiro school together. So blast from the past. Great to see you again, Russ.
Good to see
Again, you do a lot of functional neurology, brain work. Your website's azchironeuro.com. We'll put the link in the show notes. You also have a excellent coaching functional neuro program at btbhealthsystems.com. So more information about some of the things we're going to be talking about can be grabbed at those sites. We'll put the links below in the show notes as well. Dr. Russ, welcome to the show, man.
Hey, Dr. Justin, thanks for having me. It's good to see you again. It's been a while. I feel like we're old men now. I'm 5 years out, so you've got to be, what, 6 or 7? And
yeah, you got it.
So following you a lot. So thanks a lot for having me on. Excited.
Well, thank you. And then anyone listening, feel free and chime in with questions. Try to keep it pertinent more to the functional neuro brain stuff. At the end of the show, we'll take a few minutes at the end and roll through your questions. So if you guys are liking the content, feel free and chime in. So Dr. Russ, tell me a little bit about what you're seeing kind of on average every day in your clinical practice. What's the typical patient looking like? What are they coming in with? What's their presentation?
So a lot of the people that we see are kind of actually going through the gamut. They've already been here. They've seen this specialist. They've seen that specialist. And I'm sure you notice it a lot. You get those specialists just look here. This specialist just looks there. This guy is a big toe on the right foot kind of specialist. And so what we try to do is we bring it all together with brain health, the whole brain, plus the functional medicine side of thing and nutrition to make sure that we're really understanding all of the components and systems so that they all work well together.
Got it. So what are those typical symptoms? Are people coming in with brain fog, anxiety, depression? I mean, obviously there's probably people that have already had like neurological damage, maybe like a stroke, or have autoimmune conditions like Parkinson's and MS. So kind of give us the rundown. Someone comes in, ADHD, OCD versus maybe a more progressed degenerative condition like MS. What do those treatments look like? How are you working them up? What does that look like?
So everybody that comes in has a brain, right? So what we do is we first start off with just evaluating the brain. It doesn't matter what diagnosis you have, it's going to show up in this evaluation and the history. So starting from a young age, I've been seeing a lot of genetic diseases lately where the system just doesn't get a chance to really activate. And so my job is to go in and activate that system so you get functionality from the baseline, like vagal nerve activation, ocular motor and vestibular stuff. Through ADD, ADHD. So you're looking frontal lobe, which means focus, attention, inability to sleep, can't remember stuff. So working memory. Moving on into adults, you're looking at more concussions, which lead to brain gut dysfunction, right? So once you open up that brain gut axis, I mean, really anything is possible. Autoimmunity, chronic pain, fatigue, open up to infection. I mean, you name it. You deal with a lot of this stuff too. So I mean, we can go off on the deep end on this, but really what we're looking at is anything out there.
Yeah. So what are like some of the neurological testing you're doing, right? I know you guys do a lot with the eyes, tracking things like that. So give me a rundown. Someone comes in, what are the first couple of tests that you're doing to assess what's happening?
Sure. So the three things that we do right out of the gate are autonomic testing, which is blood flow or blood pressure, heart rate, respiration. So all those centers are located in the lower brainstem, which is kind of like where that brain gut axis and vagal nerve is. So we assess that against gravity. So laying down, seated, and then standing. And then we go into a full balance test where you do eyes open, eyes closed, and then you put them on a surface that's a little wobbly, so it challenges them. And then we actually do what's called a cervical challenge where we put their head in different positions, kind of mimicking some vestibular activity and seeing how much the neck is involved. And then we assess the entire eye or ocular motor system, all the eye movements that we can have, fast, slow, stable, quickly moving, repetitive. And then we put people in the dark and we rotate them so that we see how their system is working when there's no other activation.
Got it. And what are you typically seeing with some of these patients? How are they presenting with some of these tests?
So often, not everybody, sometimes people are super good, but they have major neurological symptoms. When their symptoms or when their exam is normal, that's when we know we need to do all functional medicine, immune-based control or management. When we see breakdown, we're going to see sway patterns where people are moving forward, backwards, side to side. And because they're moving, they're firing motor patterns differently. And so they're having pain, typically low back, neck, this chronic pain that is coming out with these neurological or, this instability in their system. So just a slight difference from side to side over time that tends to build. And then we build things like a shoulder or a head tilt or flexed posturing, and that presents in pain a lot of times.
Got it. And how are you incorporating a lot of the adjusting that you're doing? Like someone comes in, let's say you see some deficits with eye or muscle tone, like you're a chiropractor, so you're doing chiropractic work. You're also doing neurological work, maybe exercises, different things. So how are you prescribing adjustments? How are you prescribing some of the exercises or some of the auditory stuff? How are your prescriptions based on what you see?
Well, first I'm going to say that as a chiropractor, I don't just see something and do something because I have that tool. I have to assess and think, why is this here? What is the root cause to this problem? So in an adjustment situation, I may do, if I see a right-sided cerebellar problem, which is going to be eyes closed, touch the nose, eyes closed, touch the nose. If you're off on one side, this is my right hand, then I might do an adjustment in the neck or the low back or a foot or a hand to try to stimulate that area. So just the adjustment is so powerful, sometimes it can be too much in some cases. So talking about brain health and concussions, sometimes I don't even adjust anybody for the first month or two until their brain becomes stable enough to receive an adjustment.
Got it. So when you're looking at brain function, right, we have like cerebellum, just kind of the back part of the brain by the brain, the brainstem area, which helps with balance. And then we have the cortex, kind of the higher function of the brain. Can you just kind of differentiate the cortex and
Absolutely.
the cerebellum for the listeners?
You got it. So the cerebellum is considered the little brain. I talk about the cerebellum like an old school switchboard with cables going in and out. You've got somebody, hey, you need to talk to this guy, move here, move everything here. So it's constantly calibrating everything that's going in and out of the brain. Thoughts, emotions, eye movements, head movements, vestibular activity, motor control, autonomic tone, so blood flow. All those things are helping to be controlled by the cerebellum. That cerebellum sends information to the parietal lobe, which is where we basically feel and receive all information. Then that information is sent to the frontal lobe. That frontal lobe creates a response or a motor activity, blood flow, thought, emotion, actual physical movement. And then the cerebellum makes sure that that is very coordinated. If the cerebellum's off, you're going to get things like movement or dysmetria, things like that.
Okay, got it. And then when you adjust, can you kind of talk about some of the, so when you adjust, you're helping the opposite brain, right? Because the brain tends to cross paths, right? So an adjustment on your right side may help bring up that left cortex and vice versa on the other side. Is that true?
Yeah, so yes and no. So in some cases, like the diversified technique, which is what most docs use, you'll contact one side and then you'll give a quick rotation in the opposite direction. So yes, you're adjusting the neck on that side.
Yeah.
Based on muscle spindle activity. As the muscle shortens, you're getting increase in information. As it lengthens and you activate, GTO for you and I, but basically if you inhibit a muscle, it decreases
Golgi tendon.
So more information, less information. But here's the kicker. As you rotate your head, you're actually activating the opposite side vestibular system. So you're kind of getting a bilateral effect. The technique that I use is called coupled reduction. So it's a lateral bend, and that bend is only in one side, the majority of it. There's no way you can just do one little piece, but the majority of the information is a little more specific from one side.
Okay. So if someone has, let's say, a weak cortex on the left versus the right, or right versus the left, what kind of symptoms would they see or express?
So the left brain is highly associated with language, with numbers, with letters, with speech, with logistical and logic, order-based planning. So a lot of these folks tend to be, also it's kind of the go side. So the right brain is the opposite of all those, creativity and whatnot. So you may see some lack in understanding, like dyslexia is a very common left brain issue. You may have focus and attention issues. You may have some garbling up of words. You may have some issues with, articulating words and things like that. You may have some changes on the right side of the body with sensory issues. You may have issues with memory, with face, and other things of learning new objects versus understanding who that is. kind of thing, even though you've met them before. So a lot of different things can be in that left brain.
Okay. And then how about if you're having issues with the cerebellum in the back?
So that cerebellum is going to be highly associated with that coordination, right? So you may actually sway to the right side when you close your eyes. You may have a little bit of a tremor in that right hand. You may have an issue knocking things over. If you go to grab your phone and you knock it over, or a glass or a beer for that matter, you may bump into things on that right side as well. You're going to have changes in muscle tone on that side, meaning like chronically rolled ankles. You're going to, stub your fingers, stub your toes, and you may have an increased startle response from that side because you're not really sure of where that right side of your world is.
Okay. So if someone's listening at home, right, and they're like, all right, well, I'm thinking about going to see a functional neurologist, someone like yourself, what are some things that people could do just on their own right now to kind of help with overall brain balance? Is there any self-assessments or tools that they can utilize?
Sure. There's a really good test is put your feet together, close your eyes, and see if you can stand still. You can try one leg versus the other, right? That's a really good test. It comes out immediately. There was a research project done that says if you can't stand on one leg for 15 seconds, you're going to have an increased risk of developing a neurodegenerative disorder, which is cerebellum to frontal lobe. So all this activity is brain-based. Finger to nose, closing your eyes and trying to touch the tip of your nose right here, right? So bring it out, touch the tip of that nose. If you're off a little bit, or if you hesitate or you poke yourself in the face versus the nose, that's a problem in the cerebellum on that side.
Got it. And let's talk about the diet component. How much does the diet affect the brain? I mean, we know gluten, the protein in wheat, barley, and rye, and other types of cross-reactive grains has major effects on antibodies in the brain, whether it's gangliosides or myelin or increasing GAD antibodies. What's your take on diet? And we can even go into blood sugar imbalances on brain health.
So in our clinic, we see a lot of concussion. Usually it's post-concussion syndrome. Now, the reason that these people got to this post-concussion status is because their brain was in a state of unhealth or dis-ease, so to speak. So it wasn't all that healthy to start with. And so there was something going on with the gut. There was something going on with the brain. There was inflammation. There was a bad diet. So many different things go into it. So when you look at that, who's presenting to my office? Going gluten-free, going dairy-free. That's the easiest thing to do.
Foundational.
Inflammation. So we don't need to beat that horse anymore. But the things that I like to do right out of the gate are decrease blood sugar by decreasing carb loads. So that promotes what's called autophagy, right? You increase your healthy fats, decrease your blood sugars or carbohydrate intake in food and in drink. And that helps to promote autophagy. Autophagy is a big word for bring the garbage trucks in, clean up all the junk, and move on, right? That's why a lot of people feel so good with this ketosis or ketogenic diet, not necessarily long-term because you need glucose to fuel those cells eventually, but in the short phase, we almost always do like a ketogenic type of diet along with some other, I've got a whole bunch of supplements that we use to promote brain health after the fact, but you can always do them before the fact as well.
Totally right. So the brain's really important, when it comes to blood sugar and insulin resistance. We know the insulin degrading enzyme is partly responsible for degrading insulin and breaking down insulin. It's also responsible for cleaning up a lot of the plaque and the inflammatory kind of proteins in the brain. So if you have a lot more insulin in the system because your carb load's much higher and you got insulin resistance, that enzyme is going to be too busy over here cleaning up insulin versus mopping up the plaque. It's like having one janitor where the mess you kind of need two, right? So that's why getting that insulin resistance, getting your cells more sensitive to insulin makes the difference. Is that true?
Absolutely. And one of the things you said, basically when there's too much junk and there's too much insulin, what does that create? That creates free radical activity and inflammation. So once you develop inflammation in the brain, there's something called a microglial cell. They're like the janitors, right? All of a sudden there's 10 times as many janitors in the brain as there are neurons. So when these suckers get ticked off, they clean up everything. They're taking trophies out of the school, right?
Yeah.
They're taking the trophies, the pictures off the wall, the chairs out of the room, they're ripping the carpets up. So they're basically cleaning up anything and everything in their sight. And that starts to break down other neurons. So that inflammation is what we as clinicians and you guys as patients need to start thinking about. The more inflammation you have, the worse your brain's going to do. So right out of the gate, we get people on turmeric and resveratrol. I like turmeric with black pepper for absorption.
Better absorption, right?
Unless they have sensitivity to black pepper. I'm actually seeing that in a lot of cases. So we have options for simply turmeric, or we high dose other things as well. So resveratrol, a great antioxidant to help keep those free radicals from dinging things up. Right after a head injury and long term, you're going to lose blood flow by about 70%. So we use a component or a nutrient called vinpocetine or vinpocetine, which helps to improve basically capillary perfusion. So you start immediately getting more blood flow to your brain. On top of that, omega-3 fatty acids, right? That's probably going to be every patient should be on those unless you have a sensitivity or you can't tolerate fats. But that's another issue altogether. We can address that separately. I usually use anywhere from 3,000 to 5,000 milligrams a day personally. I've heard dosing as high as 10,000 milligrams or 15 in severe cases. Glutathione or N-acetylcysteine. Glucophorinin is a product that I use in one of my lines that we use in the office. It's phenomenal. Let's see what else. Mag 3 and 8 or patented Magtine. I use Zymogen personally, but it's a great product. Mag 3 and 8 helps to keep your brain from overfiring. So if you've got this cell that wants to fire on its own, it just goes boom. And each cell around that starts to go boom, boom, boom. So you get this what's called spreading cortical depression. That's seizure-like activity. So when you get symptoms that show up for no reason, you're having the seizure activity occur. And so one of the things that can help stop that overfiring is that magnesium 3 and 8, and it is phenomenal. We use mag 3 and 8 because it passes the blood-brain barrier.
Yeah, it makes sense. I know the kynurea pathways or the quinolinic acid pathway, which is an inflammatory pathway in the brain, gets dampened by higher magnesium. And I know magnesium 3 and 8 is one of those magnesiums that can cross the blood-brain barrier. So that makes a lot of sense. And when someone's having kind of a seizure episode, what's actually happening in the brain? And I know ketogenic diets have been recommended since 1920 by the Mayo Clinic to help with seizures. So we know there's a blood sugar component. What's the mechanism happening with the brain that's causing the seizure, and how's the blood sugar and maybe the increase in ketones, how's that stabilizing the brain?
So essentially, every brain in a simplistic form, you need multiple things to make a cell work. Glucose, proper amounts of glucose, oxygen, and activation. All three of these things help to create ATP or energy. Right? So ATP is our energy source. Think of it as, just oxygen in this case. If we don't have oxygen, we're toast. So that ATP, consider it like a lifeline. And so all of these things have to be in proper amounts in order to make proper amounts of energy. When you start having excessive firing of these cells, you start using up your glucose, you start firing randomly. So ultimately it lets too much calcium in, and that starts popping off the cell. So that's why we do magnesium, and actually magnesium has a little plug that plugs up that receptor that allows too much calcium in. So that's why magnesium is so important in that case. Blood sugar instability, as you drop too low, you start to starve, and the cells start to fire off to try to survive. So that's where blood sugar stability comes in. If you have too much, you develop insulin resistance, so fuel can't get in. If you have too little, you don't have any fuel, so the cell starts gasping for air, essentially, and it starts popping off and firing off saying, hey, somebody help me, I'm going to die. And that's what happens. As they fire off, they release excitatory neurotransmitters, which are called glutamate or excitotoxicity is what we're talking here. So you excite all the other cells around you, and if those are unstable enough, they'll fire off to the point where they die too. And so you actually get dying of cells and fatigue of these cells. So then you lose your ability to talk. You lose your ability to balance. You lose your ability to have a proper emotional response to somebody asking a simple question. You can't sleep, right? All these things, all these symptoms come from many times unhealthy brain tissue.
Totally makes sense, because we have this kind of Goldilocks effect with high blood sugar, decreases enzymes in the brain that clean up junk. And then you have this decrease in cellular autophagy or autophagy. I'm not sure how it's pronounced either way. And then you have the low blood sugar side where blood sugar drops, and that can create increase in interleukins and various cytokines. Interesting fact, though, you mentioned that the magnesium, because when that cell needs to contract and that action potential happens, where that nerve impulse, that there's a release of calcium. So that makes sense that magnesium kind of keeps that down, so it decreases the excitation in the cell. Is that what you're saying there with the magnesium?
Yep.
Okay,
Absolutely.
very cool. And then also a couple other things too. You mentioned the magnesium component. Let's go back to some of the antioxidants. So we have things like resveratrol and turmeric, which kind of are like in these NRF2 pathways, which really help clean up brain inflammation.
Yep.
I was at a seminar last weekend where there was a couple of strength coaches at a major university. I think it was University of Oregon. And they would, when their players would come off the field, they would actually make their players consume grape juice. And it's interesting because it makes sense because the grape juice is very high in resveratrol. I think they could probably do it better with the supplement without getting all the excess glucose in there. But what's your take with some of these nutrients and the NRF2 and just cleaning up brain inflammation? Let's say your kid is an athlete and they're involved in contact sports. What can they be doing to help with that?
So a couple of things, and I'm going to kind of answer this in two parts.
Yep.
There's people who play sports. Like for me, I was playing every single day. I know there's a lot of kids that are going from one practice to another. So there is such thing as overtraining, right? The difference in building versus breaking down. So you have to really watch that stress response, your adrenal glands, your changes in blood sugar, that fatigue rate, and keep an eye on your ability to make energy. So number one, just watch out for overtraining in especially young kids and especially things like triathletes. Okay. So when we get into what we do after, or even what we do prior to these contact sports, is number one, you've got to make sure they have a good, healthy blood-brain barrier and a good, healthy gut, right? If you just focus on those two things, the majority of your inflammation will probably be taken care of, right? So having somebody on probiotics is excellent. You're going to be having, you're going to be promoting, multiple strains, not all of them, but a lot of strains that are supposed to support gut. You can use things like glutamine or aloe vera to help impair or repair that gut lining, to make sure that these, you're not having too many critters coming in that are, you can break down all your food, so you don't have too many exposures to a lot of this gluten stuff and food sensitivities developing and all that. For brain, you've got to have your omega-3s. You want to have turmeric at least in your cupboard at all times, right? And then you're going to want to have something to make sure you're having blood flow, which is that vinpocetine, as well as, honestly, the 3 products that I'm on, or 4 products that I'm on all day long, or every day of the week, is a monoglyceride form of omega-3, right? Because it goes triglyceride, monoglyceride in the delivery system. So it's a little bit easier way for me to get that. So it's a little more effective. Cognaquil, which is a magtine or mag3, as well as some B vitamins. And what else do I got? T-crin. So it's another form that helps promote dopamine activation, keeps your frontal lobe firing and building. So it's a D1, D2 activator. And then I use, you just mentioned it, I'll just kind of show this, NRF2 activator.
Yeah.
So just not promoting any products there, but that's what I'm on.
That's okay.
And then a Memorol supplement. All this stuff is from Zymogen. Memorol has huperzine in it, which helps with memory. It's a acetylcholinesterase esterase inhibitor. And then vinpocetine. So,
and what pathways in the brain is acetylcholine hitting?
Temporal lobe and hippocampus. So your hippocampus is the memory component, which is what breaks down in Alzheimer's.
Interesting. So if someone is doing contact sports, you gave some of those nutrients that can be helpful. I'm going through Tom Brady's book, The TB12 Method, and he's all about pliability when it comes to lifting weights. It's really interesting because he's trying to get his muscles to be as pliable as possible. His kind of theory is that the muscles get, more dense, harder, that training is, creating concentric contractions. And the problem is with that, the muscles just are harder and they have less eccentric capability. So they have less ability to absorb. So his thing is he's trying to make the muscles softer and more pliable so they absorb force. And then I know I looked at his supplement regimen. He's doing a lot of green tea, resveratrol, probiotics. He's doing a lot of curcumin, pre and post workouts or pre and post game. So I think he's on top of this stuff too.
Sure.
And I think he's also doing potentially some O2, O2 chamber stuff and maybe even some laser stuff too.
Sure. Oh, laser. Glad you brought that up.
Oh, yeah.
Laser right here, actually.
Oh, great. Zirconia laser. Wonderful.
Zirconia laser. If you guys don't have any, do you have a laser over there? Do you use laser therapy?
I've done in the past. I do not currently, but I think it's phenomenal. I think if you were like, if I was letting my kid play a sport that was contact related, I'd have all those nutrients on board, and I would also have some kind of a laser therapy on board to help with the inflammation. What's your take? Would you let your kid play contact sports without utilizing these techniques?
Absolutely not.
Yeah.
No way. I'm even considering getting him into a sport where the contact is not involved on every play. I don't have kids right now, but moving forward, I'm a golfer, so the odds of you sustaining a concussion in golf are pretty low unless you're just, you're not playing fast enough. But in football, in soccer, in baseball, I've been knocked out in baseball before. The risk is always going to be there no matter what sport you're in. But if you choose to put your kid in a sport where they're hitting helmets, they're hitting bodies every single play, I mean, what do you expect the outcome to be, honestly?
Yeah, so exactly.
My job is to educate, not to make decisions for people. So that's kind of, I don't like to speak out of turn, but for me, that kid is going to be on certain products, nutrition every day of the week. And it's really all about promoting brain health and gut health, because any people that I see, and this is a clinical thing, anybody that I see that has had gut issues, anxiety issues, leaky blood-brain barrier, leaky gut, autoimmunity, long-term standing chronic illness prior to hitting their head, those are the worst cases that I end up seeing, meaning that nobody can help them until we address all of these different things together and rehab the brain on top of it.
100%. It makes sense. And again, most kids today, their diets are absolute crap.
Yep.
Here's the analogy I've kind of over the last few years. It makes a lot of sense, but a lot of people look at food as calories, and that it's like going to the gas tank and you just put fuel in your gas tank and it doesn't matter what fuel you get. Right. The difference is when your engine starts running on low and you're driving that car, your car doesn't start metabolizing the bumper or the seats for fuel. The difference is our body will do that. And it's also not looking at calories, which is just a measurement of heat, right? It's also looking at the micronutrients. And today we can have a whole bunch of calories with very poor micronutrient levels, meaning low minerals, low vitamins, low amino acids. And plus, when you're having excessive and the carbohydrates primarily refined, when you throw that fuel into the Krebs cycle and glycolysis, it takes B vitamins and minerals and magnesium to run the system. So if you get less than what the system costs to operate, then you actually go into nutritional debt. Can you talk more about that?
Yeah, and that's kind of what I was talking about with that overtraining, kind of bringing it. So the thing, and I'm kind of going to divert, but then come back to it.
Yeah, totally.
Stress is one thing that I feel has to be addressed in every single patient. Stress cranks up your cortisol, cranks up blood sugar, starts sending those cytokines you talked about. They start lighting up an area of the brain, which is essentially the fight or flight area, the midbrain, right? That area is what keeps you awake at night. It's what keeps you from focusing. It's what leads to basically depression and anxiety. And so all those things where you're not firing optimally, right? Optimal firing would be here. That's where we want to be. When we go here, not so good. So when we go to blood sugar and all the things that you were talking about, it's really, you just have to address everything. I hate to say it like that, but you really got to look at every different system and how they interact.
So we kind of have like the chiropractic side where it's working on stimulation and kind of giving one side a bump or a knockdown. Then we have the nutritional side, which is really getting rid of the inflammation and then providing extra nutrients to support healing. The laser kind of the same way. You're really helping those cells. You're stimulating those cells in a way to help heal and recover and reduce inflammation, because a lot of these wavelengths are very anti-inflammatory, which is great. If someone gets a head injury, I know some of the therapies are kind of a low-calorie fast for a day or two to help increase that cellular autophagy. Some will say, even some progesterone, maybe 50 to 100 milligrams a day, even for guys, can be helpful. I mean, the turmeric, the resveratrol, those kind of things. What else would you be doing if someone had a concussion or a head injury? How would you be treating that therapeutically outside of just the laser and maybe O2 therapy?
So outside of that, acute, everything that you just mentioned, and everything that we've already been talking about. So glutathione, omega-3s, vinpocetine, resveratrol, You've got your turmeric. You can go right into gut support and rebuilding the gut, because all the
probiotics.
All the research shows that if you injure your brain, within minutes to hours, you develop a leaky gut. So you have to not only fix the gut from a nutritional side, but you have to fix it from a brain-gut axis. So typically what we'll do is we'll get going on the nutrition and bring people in for laser only. If they can tolerate it, we'll run an exam and evaluation that first day, and then we'll say, hey, come back in about a week, and then we'll check you out again. Because most concussions should heal in 2 to 4 weeks, but we like getting a baseline, so we know that in 4 weeks, if they're not healing, we've got them. We can show how well they have healed, right? And so that's the stuff you need to be doing in the acute phase. Hyperbaric chambers you can do more so in the acute phase. They seem to do better. The chronic phases are kind of the jury's still out on them. And then chronically, basically the whole system is involved, because you develop that leaky gut, you start ramping up inflammation, you start breaking down the blood-brain barrier, microglial cells are going crazy, all your neurotransmitters are off. Now you've got the HPTA, hormone axis, all this stuff is starting to fall apart. So ultimately, once you get into that chronic phase, you just got to start evaluating, especially when it comes to hormones. In women, you've got a lab, you've got to look at all the comprehensive metabolic stuff, which is all the labs that we run, as well as you can do specialty testing. So, I mean, you really got to, if you have that stuff going on, like a concussion or post-concussion syndrome, and the doctors that you're seeing are not running these labs, you'll find it somebody who will.
Can you talk more of the mechanism? Because I've seen this so often where there's an incredible stress response. We know cortisol can break down areas of the brain, especially in the hippocampus, which is involved in memory. And then we can see that then creates a leaky gut. Or we see a head trauma like a car accident. And then we look at their history. And then from that point onward, things spiraled out of control with other digestive issues and then more autoimmune stuff. What's that mechanism? Why is the trauma in the brain? How is that causing that leaky gut? What's the mechanism there?
Cool. I'll show you here. So I'm going to draw this out, kind of. Can I draw on this? Is there a way to do that?
Yeah. Not sure. But if you got any paper, just draw it up and hold it up on the screen. That's perfect.
Cool. So this is just super quick. All right. If I had a whiteboard, this would be so much easier.
Perfect.
Okay. So right here.
Yep.
Is kind of what we're looking at. Right brain, left brain. This is our brainstem. So this is the midbrain we talked about, the pons and the medulla. This part here is the parasympathetic part. This part here is the parasympathetic part. This part here, parasympathetic. This big guy right here in the middle, he is the sympathetic dominant guy. He gets lit up in head injury. Everything else starts to break down. Now what's interesting is basically through here is a major conduit of, I'll call it like a freeway. All information that gets from the brain to the body has to go through this brainstem, and this is the area that gets hit the hardest in concussion. So these two big lines, the vagus nerve, that's part of that conduit or that freeway system. So as you get whacked, immediately inflammation goes up, decreases your sympathetic tone. Decreases your parasympathetic tone, increases sympathetic tone.
Correct.
And fight or flight, you're not going to worry about digestion, right? So right away, that's what starts breaking down your gut.
That makes sense. So the blood flow starts going more towards the extremities, away from the organs.
Yep. It's basically saying, hey, you need to survive, run, get the heck out of there.
That makes total sense. All right, interesting. And then you said the area right in the middle part's the sympathetic. So when that gets lit up, then that basically decreases the parasympathetic tone. A couple of people on the chat here wanted to know ways to help increase the parasympathetic tone. I mean, in the functional neurological community, there's stimulators like singing or kind of a gag reflex kind of thing. There's obviously, breathing through the nose, right? Because of the olfactory nerves. Obviously, eating an anti-inflammatory diet and lifestyle is going to help. What else? Are there any other more nuanced things that you're working on patients with? Absolutely.
So gargling. Gargling is probably the easiest and most cost-effective way that isn't like gagging yourself, but that's still effective too.
Right.
So anybody who needs more parasympathetic tone, they start gargling. It's as simple as taking a drink of water Gargle as long as you can, as hard as you can. If you can only get 1 or 2 seconds, that vagal tone or that parasympathetic tone is dampened. So we need to get better at it. We're going to practice at it. And then you can do things like humming and singing, which activates the back of the throat. You can do what I call tongue push-ups. Push tongue into the side of the mouth. So that's cranial nerve 12. It's right below the vagus area. Any sensory stuff. So taking your toothbrush, tapping the back of your throat. Best way that I found is actually push down on the back of your tongue. Don't jab yourself back in the throat. And then what you can do, well, I'm not going to give away any neuro rehab because it would be inappropriate for me to give somebody an exercise to do that's
Right.
Not specific to them. But we use what's called a vagal nerve stimulator. And so it's got 2 prongs. We can use it in the ear on the vagal afferent here in the concha. We can also use it on the SCM to the point that the muscle actually contracts a little bit because the vagus nerve runs right along that SCM. We personally stay on the right side of it because it has more to do with rate of the heart versus rhythm. You don't want to disrupt the rhythm per se, but if that's what the evaluation indicates, then we go ahead and go very cautiously with a pulse ox on their finger.
Now, if we don't have the low-hanging fruit addressed, like if this person is, let's say, consuming gluten, poor sleep, poor blood sugar instability, just doing some gargling won't be enough to overcome all of the sympathetic habits on the other side of the fence. Is that true?
True. It won't fix the problem, but it will start activating that pool of neurons to try. It'd be like going to the gym and eating like crap.
Got
At
it.
least you're going to the gym.
Great analogy.
And so at least you're getting some type of brain activation. Another piece on top of that, sorry to interrupt, meditation. Meditation, mindfulness, de-stressing yourself, huge.
Makes a lot of sense. That's excellent. And then regarding the gut component, right? We didn't really talk much about, because you talked about the brain and then you talked about that could cause the leaky gut. We also have leaky gut and leaky brain starting from the gut. We can have H. pylori or dysbiotic bacteria with lipopolysaccharides that then open up those tight junctions in the gut, and then those things can get past the astrocytes or the blood-brain barrier. Can you talk about gut to brain issues? We just addressed brain to gut. And then what % of our brain are microglial cells, which are the immune cells? Is it 20% or is it higher?
Well, let's put it this way. I don't know the exact percentage, but you have 10 times as many microglial cells as you do neurons.
Neurons, perfect.
So there's a lot. When we talk about the gut brain, let's say it's more than likely going to be from an infectious side or a food side, because that vagal nerve, if that's not firing well, you're going to break down your gut anyway. So you're talking about that brain gut axis kind of as a general assumption, right? So let's say we go out of town, we're feeling great, we get a parasite or we get an infection, right? That starts to cause that internal inflammation, downregulates and crowds out all your good bacteria, starts screwing with everything. Inflammation shuts down your motility. Motility means how well we move stuff through our system. So we start to get constipation and or mixed diarrhea, right? With H. pylori, it's kind of a little bit of both. And so when you have this breakdown of the gut, you start to develop that leaky gut. What's interesting is the blood-brain barrier is the same type of connection, occludin zonulin, as these tight junctions. So the stuff that breaks down the gut is the same stuff that breaks down the brain. That's what we're finding. So leaky gut equals leaky brain, or gut on fire equals brain on fire.
Great. Excellent. And how many people are you seeing just in general where you're seeing the neurological issues are starting from the gut versus starting from a head trauma? Is it 50-50? Are you seeing more on the brain just because you're marketed as a neurologist? What are you seeing?
Okay, this is going to sound weird. I'd say 50-50, but 100%.
Mm-hmm.
Right? So if it starts from the gut and it's like there's an emotional trauma early in childhood, you're going to have that sympathetic stress-related response, which is going to break down your gut. And that's going to open it up for opportunistic infections. If you're eating poorly, leaky gut, leaky brain. If you're super healthy and you're able to travel the world, you expose yourself to more infectious stuff, right? So that's always part of the history is, when did this start? Where did you go? Did you have an emotional trauma at that time, an injury, an infection, whatever it may be? So on one hand, it's like 50-50, but on the other hand, it's like 100%.
Great. Awesome. So I'll ask one more key. Well, is there any other key kind of concepts or issues you want to get across to the listeners? If not, I'm going to go into rapid fire mode, but anything else?
Oh man, just take care of your brain. Seriously, it's the only one you got. If you know somebody with laser and that can handle this type of nutrition just like you do, you also know somebody who can fire the right parts of the brain at the right time, at the right frequency, then you're going to be in pretty good shape. So if you're struggling with any of that stuff, you need that holistic approach so people can work on all of these systems at the same time, not one system this week, one system next week, you know?
Awesome. Great. So I'm going to go into rapid fire mode here. So if you could try to answer everything in like 1 to 2 sentences, maybe 3 max, we'll roll through it.
Yep.
So vitamin D, how does it help the brain?
It basically helps with immune system balancing. So T regulatory cells, you got to have it.
Excellent. Marijuana, do you recommend it? And then THC versus CBD for brain.
I personally don't go into that because I don't know. Stuff's changing every day. I know anecdotally some people do well with it. Other people feel horrible on it. So I'll refer to another practitioner for that.
Got it. Let's see here. Another one here. Intermittent fasting, ketogenic diets. Is that the foundational diet you recommend?
Yeah, so I do it probably 2-3 days a week. I'll do an intermittent fast. I'll go through breakfast, so I'll eat dinner, won't have anything after. I'll go through breakfast, and then I'll try to have a high fat, good quality fat lunch. I'll try not to carb up. Sometimes you're just in a hurry and it happens, but I'll go past lunch sometimes. I know Dr. Barry, the guy I work with, phenomenal physician, and he does a 24-hour fast once every 3 weeks, I believe. I haven't gotten up enough courage, and I'm sure that my staff would hate me for it. So there's that. Yep.
Very cool. Can you lose fine motor skills and be dizzy without an injury, like showing a clean CT or MRI?
After a concussion? I'll answer.
I would just say yes. I would say after, in general, this person has, they went to the ER and they got these neurological tests done, but they still have these fine motor issues.
Sure, absolutely. You can have it at any time. If the brain breaks down in any way, frontal lobe and cerebellum, you're going to have issues, with dexterity, fine motor control. Dizziness is a cerebellar vestibular thing. So if you break an arm and you don't move it for 6 months, you might develop a dizziness problem because you're losing feedback from your world. That's one way. Another way is inflammation in the gut. You can develop food sensitivities, gluten. You can get TTG6 and neural autoimmunity, and that can cause dizziness. You can hit your head. That causes the symptoms you're talking about right away. You don't have to hit your head to get a concussion, okay? Like flexion extension, whiplash injury. You can have a concussion without hitting your head based on the neurochemical result.
Right. Makes sense. Yeah. We don't have a seatbelt holding our brain in place, right? You see like a woodpecker outside kind of banging their head against the tree, so to speak. They actually have ligaments that actually hold their brain in place. We don't have that. So that makes a lot of sense. Regarding TCE, traumatic chronic encephalopathy, that's the concussion issue. What's your take on it? And what's your take on the new test that can supposedly detect the TCE proteins within 20 minutes after injury?
Well, I guess technically you're probably looking at more of the inflammatory response with that test. So that's going to tell you if you have an injury or not. It doesn't tell you what you need to do nutritionally, right? So getting the diagnosis is important. I always assume that there's a concussion if there's any type of impact. For instance, I just had a patient chemically concuss 2 weeks ago when they got an infection. They got just a run-of-the-mill like a lung infection, and that reconcussed them, and they ended up with POTS in my office. So you can chemically reconcuss yourself, so you don't have to hit your head. And I mean, really, that's what it comes down to. So CTE is a major problem and it's obviously in the spotlight right now. Do all these things that we're talking about nutritionally, fire the brain the right way, and you're going to make a better connection with those neurons that you have left so that you can improve your quality of life.
Do you think microglial activation is part of the mechanism with TCE?
Yep, 100%.
Okay, excellent. And then regarding, let's see, my next question here. Also, some of these injuries too could be autoimmune. They could be on the lower kind of subclinical autoimmune side too, and then you could start to have these neurological issues. It may not even be a chronic or a trauma, right?
Right. So, well, what's the root cause of autoimmunity?
Leaky gut, gluten sensitivity, blood sugar, infections.
So this CTE and brain-based dysfunction is really not that much different in the process of autoimmunity, right? You develop CTE, you have all this other stuff, whether it's chronic traumatic. I mean, trauma can come from emotional trauma. Like I see people that have had one concussion their whole life, and it was a minor one, and their brain has shrunk to the size of like a grape versus an orange, right? I mean, they have all this atrophy, and I mean, they're just inflamed up the wazoo. They've got anemia. Everybody, all their doctors are saying, oh, it's no big deal. You just take iron. Well, it's a B12 deficient anemia. So you've got to have somebody that's going to look at this stuff.
Totally. Makes a lot of sense. And then regarding, you talked about the marijuana component, you talked about the leaky gut. When people get a concussion, do you make them stay up that whole next day? What's the mechanism with making someone stay awake and not letting them go to sleep, essentially?
So honestly, I'm getting to the point where I CYA, or covered my ass.
Yeah.
I send people to get a CT in the acute phase. A couple $100 to make sure that you're not bleeding is the number one thing, right? So that's, if somebody's like, hey, I just hit my head. All right, go get an image. They're like, well, it's just this symptom. I'm like, hey, that's up to you. My recommendation is to go get that image. So if you're still experiencing these weird symptoms a week later, they're probably going to run an MRI. Okay. Now, if everything's clean, then you're going to rest a little bit, but we need to actually get that body moving, start doing some of this nutritional stuff right away, and start instituting some of these supplements and nutrition pieces. One thing you don't want to necessarily do right away, and this kind of goes 50-50. We go back and forth with this, honestly, depending on the presentation. You may not want to dampen that microglial response right away because you want them to clean up the junk.
Right.
You want them to over clean stuff up. So most of the time I do nutrition, glutathione, omegas, vinpocetine, resveratrol in that first, 2 to 4 weeks. And then based on the symptoms, as they're starting to improve, then I'll start hitting the turmeric and heavy dose, like fire hose, so to speak.
That makes a lot of sense. And then regarding the staying up, is it just because it's a sign that there's not a bleed happening where they could be asleep and you don't know if they're passed out because of a bleed? Is that the main reason why? Yeah.
So a lot of people, I mean, you can have a slow bleed that takes 2 weeks to really create a life-threatening symptom. Right. So that's what I just default to that CYA and make sure, instead of guessing, right. I'd rather run this and be wrong than not run it. And you know what I mean?
And in conventional medicine, I mean, they really don't have much. It's like keep them up for 24 hours and then wear some sunglasses. Right. I mean, that's pretty much the conventional medicine treatment. Right.
Yep. Yeah. So just watch and wait. They're like, watch and wait and learn to live with it.
Wow. And then with progesterone, we talked about that as having some really good effects outside of just fasting. What's the dose with progesterone you like?
So that's actually one thing I was talking to my business partner before this. Currently, we do not give progesterone, although in the research it has shown to be neuroprotective. You're not sure where that person's progesterone levels are, especially in women, because it's all based on where their cycle is. If they're at a certain place and their progesterone low and they hit their head, they're going to have a way worse response than if it's elevated.
Right.
So when it comes to hormones, based on that HPH, I guess, hormone axis, we don't do that. We lab for it.
Okay. Got it. But if it's a guy that doesn't have a cycle, is there a 20 milligram dose, 50 milligram dose?
Tell you what, I'll follow up with you once kind of the verdict is out on that, and then we'll throw it in the notes.
Perfect. That sounds great. Cool. Well, Dr. Russ, is there anything else that you want to highlight?
Sorry, you just froze. Go ahead and repeat that.
Yeah, no problem. Is there that answers all of our questions here for today? Is there anything else you wanted to highlight that maybe you missed that you want to emphasize?
Yeah, if anybody out there is looking for a functional neurologist or a chiropractic neurologist, feel free to either post a message here or contact me directly through the website, either russ@btbhealthsystems.com or azchironeuro@gmail.com. And I'll try to get you in contact with somebody in your area. If we can't find anybody close, we do intensives all the time where we get like 6 weeks of treatment in 1 week. Try to get you as good as possible, and then we return you home to somebody who can manage your condition at that point.
Do you work with any patients over Skype or a computer?
We do a lot of times it's over the phone. Like right now, I'm talking with somebody in London. I'm getting them set up with some nutrition and some laser therapies. So they're getting to the point where they're going to buy a laser because they can't travel very much. We see people, we have more people fly in for the neuro rehab component than we do the nutrition over the phone. And I mean, just stuff like this is invaluable too, to be able to get this information out there like we are.
That's awesome. Dr. Russ, thank you so much. Russ Teams at azchironeuro.com. He's got health coaching for various doctors, BTB Health Systems, plural.com. We'll put the links below. Dr. Russ, thank you so much for coming on the show and dropping some serious knowledge bombs. We appreciate it. You have a great weekend.
Sorry, last thing.
Yes.
We have a seminar coming up next weekend in San Francisco, Saturday and Sunday. Dr. Brock, myself, Dr. Barry, and Dr. Jared Siegler from the Living Proof Institute.
Oh, great.
We're going to be hammering autoimmunity, brain-gut axis, so expanding on everything we just talked here today. So if you have anybody or any doctor you want to know more about this stuff, we're happy to have them.
That's great. And Dr. Jared was supposed to be on the podcast last week. I had to reschedule on him. He'll be on here really soon as well. Well, thanks for sharing that, Dr. Russ. We look forward to connecting soon.
Okay, sounds good. Thanks, Dr. J.
Take care.